Hi, I'm Jocelyn Compton, and we're now going to talk about the development section of behavioral science. Let's start with the APGAR score. The APGAR score was devised as a quick assessment of newborn health by Dr. Virginia Apgar. This chick right here. It's a 10-point scale, and it's evaluated at 1 minute and at 5 minutes. The APGAR mnemonic stands for appearance, pulse, grimace, activity, and respiration. Each of these parameters is given a score of 0 to 2, 2 points being the best. A score of 7 or greater is normal. 4 to 6 requires assistance and some stimulation. But if you're at less than 4, you have to start resuscitation to prevent long-term neurological damage. Let's have a quick flash quiz. When is the APGAR evaluated? At 1 and 5 minutes after birth. Low birth weight for a newborn is defined as a weight less than 2,500 grams. Low birth weight is important because it's associated with higher incidences of physical and emotional problems later in life. It's most usually caused by prematurity and intrauterine growth restriction. And the risk factors that can lead to low birth weight include poor maternal nutrition, drugs, alcohol, tobacco smoke, and lead exposure. Let's talk a little bit about the complications of low birth weight. You can get infections, respiratory distress syndrome, necrotizing enterocolitis, intraventricular hemorrhage, and persistent fetal circulation, like a PDA. Early developmental milestones are high yield for the USMLE. A typical question will give a presentation of a child and ask whether the milestones are appropriate for that age group. You'll be asked to determine the child's development in categories such as motor, social, and verbal cognitive. Motor milestones in the infant age group include appearance of the Moro reflex, which disappears by 3 months. Similarly, the rooting reflex will disappear around 4 months, which is a reflex to help babies find the mother's nipple. The palmar reflex disappears around 6 months, and the Babinski reflex disappears around 12 months. Other motor milestones are also starting to appear. At 1 month, a baby can lift its head in the prone position. At 6 months, a baby will roll over and sit, and at 8 months, the baby will crawl. At 10 months, the baby develops a pincer grasp and begins to stand. At around a year, the baby is starting to walk, though this can take up to 18 months. Social and cognitive milestones in the infant age group include smiling at 2 months and developing anxiety after about 6 months. First, a baby will have stranger anxiety around 6 months, and then separation anxiety around 9 months. Around 4 months, a baby can orient to voice and begins orienting to its own name around 9 months. Also around 9 months, a baby develops object permanence, where babies understand that an object taken out of sight does not mean it ceases to exist. And about a month later, babies start saying mama and dada. A child entering the toddler age group behaves very differently. At 1 year, a toddler engages in parallel play. At about 2 years, a toddler also displays rapprochement, during which a toddler will move away from the caregiver only to return for reassurance. At 3 years, toddlers start having friends and engaging in cooperative play, as well as freedom, in that they can spend part of the day away from the caregiver and develop a core gender identity. At 4 years, toddlers are able to have imaginary friends. As far as motor and verbal milestones, at 24 months, toddlers can kick balls around and have about a 200-word vocabulary. By 3 years, they're scooting around on tricycles and have a vocabulary that's expanded to about 1,000 words. And at 4 years, kids are able to tell detailed stories. Another important thing to remember is the rule for determining how many cubes a child should be able to stack. A developmentally normal child should be able to stack their age, in years, times 3. For example, a 2-year-old should be able to stack 6 blocks, or 2 times 3. What else should a 2-year-old be able to do? Kick a ball, use 200 words, and wander away from the caregiver briefly. Let's do a flash quiz. What is the definition of low birth weight? Less than 2,500 grams. Many changes occur with aging, and some of these associations may work themselves into some board's questions. With regard to sexual function, men begin to have slower erections and ejaculations and a longer refractory period. Women, on the other hand, begin to have vaginal shortening, thinning, and dryness due to decreased estrogen production after menopause. So, does sexual interest decrease with age? Absolutely not. With aging, REM sleep decreases, slow wave sleep decreases, and there is an increase in latency, or delay before falling back asleep. And there's also an increase in the number of wakenings per night. With aging, there's also a general decrease in the incidence of psychiatric disorders. However, there is an increased suicide rate as people age, and males 65 to 74 years old of age have the highest suicide rate in the United States. With age, vision, hearing, and the immune response, as well as bladder control, all decrease, as do renal, pulmonary, and GI functioning. Moreover, the amount of muscle mass and heat generating brown fat decrease, while the amount of visceral white fat increases. Of note, intelligence does not decrease with normal aging. Spoiler alert, it turns out everyone dies eventually. Thanks to epidemiology, we know what's most likely to get people based on their age. This may come up on your Step 1 exam in the context of a fairly vague question. For example, someone is found dead on the street, brought in by ambulance, and the only detail you'll get is the estimated age. Then Step 1 will ask, what is the most likely cause of death? So let's go through this table and talk about the patterns within it. Okay, so let's focus on the extremes of life first. Less than a year old and older than 65. At less than a year, what's the primary cause of death? Congenital malformations. Babies are born that aren't viable, and they die pretty shortly after birth. Some survive more than a year, so congenital malformation shows up as the third cause of death in the 1 to 14-year-old box. In the same vein, preterm birth is the second most common baby killer. What's preterm birth again? Less than 37 weeks gestation. And finally, the number 3 killer is SIDS, or sudden infant death syndrome. How about people over 65? The number 1 killer is heart disease. Now, I want to pause here and show you a trend that heart disease shows in this table. It's the number 3 killer in the 35 to 45-year-old age group, and it creeps up to number 2 in the 45 to 64-year-olds, and then it peaks in the older population. Let me show you another trend. Cancer. Who comes in first place for cancer deaths? Well, it's 45 to 64-year-olds. Who else gets cancer? Well, it's actually second place for 1 to 14-year-olds, 35 to 44-year-olds, and people over the age of 65. What kind of a distribution does cancer occurrence make you think of? Yeah, a bimodal curve, with peaks in the young population, the 1 to 14-year-olds, and the 45 to 64-year-olds. Okay, here's the next trend for you. It's suicide. Suicides start showing up in the 15 to 34-year-old group. This isn't surprising. Think about your psychiatry section. Most psychiatric diseases first show signs and symptoms in the 20-year-old age group. Similarly, homicide trends in younger people, a number 3 killer in the 15 to 34-year-olds. Now here comes the biggest killer. All of these are all the same. Unintentional injury. It's a huge killer. It really reminds us how important stressing safety interventions at home are. Seat belts and bike helmets and all that jazz. It becomes less important in the 45 to 64-year-olds, where it's the number 3 killer. There's only one more box to fill in, and it's the number 3 killer in the elderly, which is chronic respiratory diseases. Alright, good job. Test yourself. A 6-month-old child is in the pediatrician's office for evaluation. You notice that the child is able to sit unsupported and has a social smile, but doesn't recognize his mother yet. What is the social and motor milestone evaluation for this patient? A. Normal social and motor development. B. Delayed social and normal motor development. C. Delayed social and delayed motor development. Or D. normal social and delayed motor development? The answer is B. An infant should be able to sit unsupported between 5 and 8 months and should also be able to recognize people by age 4 to 5 months. The social smile develops around 2 to 3 months.